Module Overview. This module introduces you to the scientific discipline of pharmacology, providing foundational knowledge that underpins safe and effective medication use in clinical practice. You will explore the roots of drug administration, mechanisms of action, dose-response relationships, and the nurse's ethical and legal responsibilities in medication handling. Particular focus is placed on the European Medicines Agency, EMA regulations, controlled substances, adverse drug reactions, and the 6 rights of medication administration. The module is purposefully designed to align with international best practices such as those outlined by the World Health Organization, WHO, the Nursing and Midwifery Council, NMC UK, and the European Qualifications Framework, EQF, for healthcare practitioners. 1. Basic concepts of pharmacology, definition and branches, pharmacokinetics, pharmacodynamics, toxicology, terminologies, drug, active ingredient, excipient, prescription, dosage, side effect, contraindication, drug development and approval processes, clinical trials, phases, EMA regulation. 2. Drug classification and naming systems, generic versus brand names, classification by body systems, e.g. cardiovascular drugs, CNS drugs, mechanism of action, e.g. beta blockers, ACE inhibitors, chemical structure, e.g. penicillins, steroids, over-the-counter, OTC versus prescription-only medications, POMS. 3. Pharmacokinetics. What the body does to the drug absorption. Factors affecting absorption, route, pH, solubility, food, distribution, protein binding, blood-brain barrier, placental crossing, metabolism, liver enzyme action, CYP450, first pass effect, excretion, kidney, lungs, bile, sweat, implications for dosing. 4. Pharmacodynamics. What the drug does to the body. Drug receptor interactions, dose-response curve, potency versus efficacy, therapeutic index and drug safety margin, examples of agonists versus antagonists. 5. Routes of drug administration, oral, sublingual, rectal, parenteral, intravenous, IV, intramuscular, IM, subcutaneous, SC, topical, inhalational, transdermal. Comparison, speed of onset, bioavailability, patient compliance. 6. Adverse drug reactions and drug interactions, types, side effects, allergies, toxic effects, idiosyncratic reactions, polypharmacy in elderly patients, drug-food interactions, e.g. grapefruit, alcohol, drug-drug interactions, e.g. anticoagulants, plus NSAIDs, monitoring and reporting systems, pharmacovigilance. 7. Medication dosage calculations and units, basic math for nurses, conversions, mg, mcg, ml, body weight dosing, drug labels and interpretation, formula, DHX, QHX, practice scenarios with pediatric and elderly considerations, dosage errors, how they occur and how to prevent them. 8. Medication administration, the nurse's role, the 6 rights of medication administration, right patient, right drug, right dose, right time, right route, right documentation, double checking, verbal orders, patient identification, documentation, MARs, EMRs, legal implications. 10. EU regulations and standards on drug use, European Medicines Agency, EMA, oversight, EU classification of drugs, POM, OTC, herbal, patient safety standards and pharmacovigilance systems, drug recalls, black box warnings, clinical documentation requirements under GDPR and EU Health Directive.